My name is Jane Crowe. I am the Managing Director for Cardinal Health Australia and New Zealand. Cardinal Health is a global manufacturer and distributor of medical devices and consumables, as well as services and software. We've been in operations now for more than 50 years, with a footprint in over 30 countries worldwide. Cardinal Health continues to strive to improve its environmental and social governance. If we look at environmental, Cardinal Health has aligned itself with the UN Sustainable Development Goals, and we focused on 3 of those, specifically when it comes to climate change and climate impact. As a medical technology company, we are absolutely aware that medical devices and consumables and the broader healthcare sector is a large contributor to climate impact and change. And obviously, we're seeking to reduce that impact. That goes beyond, of course, just medical and healthcare if we consider what all companies are seeking to do and what the responsibility of companies is to community, to shareholders, and to employees more broadly.
Frequency of service is adjusted as needed to avoid the risk of overflow, while minimizing unnecessary visits by our field technicians and your staff to clinical spaces. For more information, please contact your sales representative or email gogreen@cardinalhealth.com.
Medical device reprocessing has been highly regulated and well established in the US now for many years. And Cardinal Health has a facility based in Florida called Sustainable Technologies. I'm pleased to confirm that Cardinal Health Australia New Zealand will be proceeding with a site based locally here. This will be the first site for Cardinal Health outside of the US. What is the impact of this site? Well, that is proven. Most recently, we released a life cycle assessment. This was conducted by an external third party with support from Cardinal Health. And that study showed, amongst many other things, a reduction of 90% in hospital landfill waste for reprocessed products. So that alone would tell you that there's a definite benefit for reprocessing in Australia and New Zealand.
The method we used in our study is life cycle assessment, shortly LCA. And what we did is to analyze the environmental footprint of an IPC device in a single-use system and also in a reprocessed system. So at the beginning, we did a system model of both product systems, and we used primary data, analyzing, like using data, for instance, which types of materials are used, which quality of energy is used, but also about the consumption numbers, how much is used. We also did kind of a distribution model to get an understanding which kind of transports are necessary within the which kind of transport is used in the product system. And then we had a system model of both products and analyzed the environmental footprint along the whole life cycle. And doing that, we got a deeper understanding of the environmental footprint of a single-use device and also of a reprocessed device. And then we could compare it. So we could make a statement which product system has the lower environmental footprint.
It also offers sovereign capability for healthcare, supply chain resilience, and some level of certainty for that if we can, of course, maintain quality supply within our shores. There's also job creation that comes from this and many other benefits. So we're excited to be able to bring this to Australia for the first time from Cardinal Health.
So why are we all here? Well, following many years successfully remanufacturing single-use medical devices in the United States, we are extremely happy to announce that Cardinal Health will be locating a remanufacturing facility right here in the Hunter region. The facility, located just 20 minutes down the road in Waterfield, will be the first Cardinal Health remanufacturing site outside of the US.
I'm Adam Walczak. I am the Director of Innovation for the Hunter New England Local Health District, and I also co-lead the John Hunter Health and Innovation Precinct here in Newcastle.
Yeah, I'm Ivan Waterfield, the CEO of HunterNet. We represent 160 organisations here, been going for 33 years, and half of our organisations are involved in the manufacturing sector. We got introduced to Jane and Cardinal Health a while back, and as part of that conversation, they were looking at their capability and the facilities that we could help them with. So alongside government, we introduced some developers, and we introduced them to some areas of opportunity that they were interested in, and from that they then worked out where they wanted to settle alongside in Beresfield, which is obviously a good manufacturing hub here in the Hunter.
This place is all about solving the real world problems that we face in health, whether those are access issues, treatment challenges, or critically and increasingly the environmental footprint that health has on the world around us. And I think in Cardinal and in Jane we've got a really exciting opportunity coming to the region. We're delighted to have her here today, and thank you for allowing us to showcase what you're doing in this environment. Several years ago, Hunter New England Local Health District took a world-leading step in identifying that in order to meet the needs of our communities, environmental stewardship was a core responsibility for our organisation. We recognise that healthcare is one of the highest carbon footprint industries globally, that we purchase and use more single-use items than most other industries in the country, and certainly more than other industries with a social remit would be comfortable with. We recognise that in order to lower the global burden of disease, we would actually have to look at how we reduce our environmental footprint. So we set an ambitious vision for our health district becoming carbon and waste neutral, one of the first local health districts in the country to do so, and we set the ambitious target of reaching that by 2030. So that means from the baseline that we were at, reducing our carbon-heavy electricity usage down to zero, reducing the footprint of our transport across our vast local health district down to zero, reducing the footprint of our waste to landfill to zero, and all doing that whilst not costing the taxpayer any more money or compromising on our ability to deliver high-quality, safe healthcare. That has been a really wonderful touchstone to have for our staff, but also for the people that we work with that supply the Australian health system.
We have more than 40 hospitals that we're currently collecting from, and we have a number of interested hospitals across all states and territories, both private and public hospitals. We have quite an extensive process where we work with all manner of stakeholders across the hospital network. It's very important for us to work closely with infection control, quality, waste management, the biomedical team, as well as clinical contracts and others. For us, it's important to have those relationships in place before we commence. Then once we do so, we have a robust blueprinting process where we set about to decide where the waste bins are to be located, and then we commence with an ongoing education program. I can't reinforce enough how important it is to educate healthcare professionals and to continue to educate them on the importance of this work.
So as you can imagine, there is an awful lot of complexity for the health system in getting to that carbon neutrality and waste neutrality. Some of the things are slightly easier to achieve. Electrification of facilities is something that is a well-trodden path, but one of the challenges that we face is we buy what is in the market. So the vast majority of products that have an infection prevention profile or things of that nature, they're single use. They're things that, by law we can only have one use in a hospital. What we really need is for the manufacturers that we buy from to come alongside us and actually help to develop the next generation of healthcare products, things that can either be born from materials that have a lower carbon and environmental footprint, or indeed the efforts that Cardinal's going to take things that have traditionally fallen into that single-use category and demonstrate really effectively that they can have a second, a third, a fourth, and even a fifth life before they need to be considered for a landfill. That partnership with industry is the only way that this ambitious agenda is actually going to be met.
This is your first facility outside of the US, so from a MedTech perspective, how can we bring many more? You'll always find, and I think you've already found that, the support you will get from industry, from government, and from the health sector will be second to none. And it's not just words, we back that up with deeds, which is always an important phrase to actually focus on. So again, we welcome you here, we're really looking forward to working with you, and anything you need in terms of help from industry, reach out. So give her a big hand, please. And as people start to see what Cardinal can do here from a MedTech perspective, then that starts to drive the economy to go, oh, we'd like to establish there as well. So we see this as the starting point, a catalyst, but over time this is going to be a good opportunity for economic growth in the MedTech sector for the Hunter region.
So not only will remanufacturing result in tonnes of material avoiding landfill, it also means that remanufactured medical devices will become a key element in Australia's sovereign manufacturing mix and provide much needed supply chain resiliency. In case you haven't noticed, we're a long way away from the rest of the world. Our specific remanufacturing process, which is TGA and FDA approved, follows the collection of the waste product, or we call it raw material, and then sorting, cleaning and high-level disinfection to medical device standards. And finally, all products, 100%, are tested and inspected. This generates a new medical device. So it has a new TGA certificate. Effectively, you could say it's born again. This is an important differentiation from reuse, refurbishment, recycling, and other less regulated options at this stage. And again, this is just the beginning for this innovative new model. We are forecasting a 12 to 18 month ramp up period where we expect capacity and output to grow significantly. I'm very proud that Cardinal Health has decided to locate its first remanufacturing site for single-use medical devices outside of the US here in Australia. I think Australia was the right location for that, and on behalf of all my team here across Australia and New Zealand, we know that we're acting as a pilot site for further locations around the world. On behalf of the MedTech industry, and I'm very pleased to represent as Vice Chair of the Medical Technology Association of Australia, I think this represents another opportunity, and I hope that many others will follow. I believe that there's opportunities both from a small and startup, and there are a number of fantastic startups and innovators here in Australia who are already doing small-scale manufacturing, but I'd like to send a call out to our larger multinational members to say that remanufacturing and manufacturing in Australia is indeed an option, and that we've found a great deal of support across all levels of government and across our healthcare partners. The benefits, as I see it, certainly bringing specialised manufacturing to this area is obviously an increase in knowledge, sharing of IP. I see obviously job creation now and into the future, particularly as we work with our partners to develop additional skills. From here, I think that there's more broader opportunities, and it's very clear, particularly through this innovation district, as to what is possible for many areas of medical devices, but most importantly, I see environmental sustainability being at the forefront.